Two of the aims of education in emergencies, ensuring continuity of learning and building back better, are dependent on the third, physical and psychological protection and well-being of children. Children can only meaningfully re-engage in education if they are and feel safe, have their basic physical needs met, and their mental health is supported and strengthened. Protection is a foundational aspect of any improvements in education in terms of access or quality, and is a key reason why education in emergencies is considered a life-saving intervention. There are various aspects of physical and psychological protection and well-being which need to be considered at all stages of the programme cycle: assessment, analysis, design and implementation. The cross-cutting issues of gender, disability, child safeguarding and conflict sensitivity also need to be looked at in relation to how they contribute to protection risks and vulnerability and the responses to addressing them. Guidance on all of these aspects is provided by INEE, Sphere, Child Protection and other sector standards. Physical protection includes ensuring schools or temporary learning spaces are structurally safe and resilient as possible to future shocks. This requires working closely with shelter experts, structural engineers and authorities, and drawing on local, regional and international good practice and standards. The location of schools and temporary learning spaces, existing or new, should also be examined to ensure that they are not vulnerable to future natural disasters, attack or occupation. Safety drills and evacuation procedures can help protect children in the case of these events. Location of education spaces can also affect the level of risk that children are exposed to on their way there. This can be mitigated through life skills education, including topics such as the risk of landmines. Sufficient, segregated and clean latrines and hand washing facilities and drinking water is essential to protect children's health and psychological well-being. Education actors should work closely with WASH specialists and sector guidance to ensure standards are met. Hygiene promotion by teachers or others can support this, as can distribution of hygiene kits in schools. The location and accessibility of these facilities needs careful consideration to ensure that they do not constitute a risk or barrier to children, especially girls and those with physical impairments. Education spaces can also be used to support other health and nutrition interventions aimed at tackling issues of nutrition, parasites, and vitamin deficiencies, in close collaboration with health and nutrition specialists. This can involve a combination of supplement distribution, feeding programs, and education to promote healthy behaviours and practices, including in sexual and reproductive health to adolescents. Ensuring schools are free from all forms of violence is an important aspect of both physical and psychological protection and well-being. This is likely to be more of a challenge in emergencies in which children, parents and teachers have been exposed to violence and displacement. Education spaces should be free from physical or humiliating punishment of students by teachers and bullying by other students. Sexual or gender-based violence may form part of this and must be identified and urgently addressed. Policies, codes of conduct, training on positive discipline and student feedback mechanisms can all help tackle this serious issue. Child protection expertise and guidance can support this process. The continuing provision of safe education provides a form of psychological support for children and their families caught up in emergencies. Structured activities delivered by trained education personnel inside and outside the classroom can provide further psychosocial support to children aiding their recovery and well-being. Teachers and other education personnel should also be trained on how to identify extreme cases of distress in order to refer these to professionals. Protecting and promoting children's social and emotional well-being in emergencies not only supports their recovery and resilience, but is also foundational to learning. Social and emotional learning, SEL, comprises self-awareness and management, responsible decision-making, social awareness, and relationship skills. Social and emotional learning can be developed through the use of specific curriculum materials and activities, accompanied by training and support to teachers in how to develop these competencies. Meeting these various protection and well-being aims requires holistic analysis of vulnerabilities and risks, ongoing consideration of cross-cutting issues, and an integrated approach to programming. This approach should be taken from the very start of a response and requires collaboration with a wide range of sectors and actors. Many of these interventions also need to consider how teachers' basic needs are met, that their workload is manageable, and they are equipped with the skills to look after themselves and their students. Insufficient focus on teacher well-being will not only undermine efforts to create a safe, protective, and nurturing environment for students, but will also undermine learning.